what I'd like to do really is to look at some of the global developments in relation to UHC, and particularly around the workforce, and then relate them to nursing and public health nursing in particular. And so what I'm going to do is particularly look at in relation to two very important publications that are referred to this morning. And one is the Global Strategy on Human Resources for Health that was adopted at the World Health Assembly in 2016. And the second one is which happened around the same time, was the UN High-Level Commission on Health, Employment and Economic Growth. I think this piece of work was particularly significant because I think it helped people understand the workforce is much broader than just healthcare, and understand that the workforce, the health workforce, contributes more widely to economic growth and to other aspects of development. So the report was very powerful in making that message and looking at the evidence that shows that if you employ health workers, so all of you are part of that, you're employed as health workers, that contributes not just to better health in countries, but to inclusive economic growth. And I think it also helps some of the discussions around how you link looking at the training and education and of health workers and the jobs and with the employment, and looking at the whole market, labour market aspect of it. And that report came out with 10 recommendations, and some of these, I don't know if you can read them on the screen, but there's one on education, training and skills, and talks about some of the things we talked about this morning, which is how training and education needs to be linked with the health needs in the population. That's what you're training people for. And the recommendation there beside that, health service delivery and organisation, which really says that when you're looking at workforce issues, so if you're looking at issues around, for instance, public health nursing, you need to look in the context of what are the service needs, and some of that came up this morning. And it's very clear, if we're talking about universal health coverage, that a different model of healthcare is what's needed for the future compared to what most countries have now. Most countries need to make a big shift away from emphasizing curative care to much more preventive, promotive care, away from hospital institutional-based care more to community-based. And I think when you look at that shift, that's going to be so important. I think you can see very clearly that public health nursing has an enormous role to play. Because nurses are everywhere in the community, and I'll talk a bit more about that in a minute. But this morning, Githinji talked about health in general, and one of the things he talked about was life expectancy. And I just happen to have this slide to show. And this says something to me very, very powerful about what's happened in health in recent times. Because you can look back over centuries, and life expectancy in the world for centuries was under 40 years. There was no improvement. And it was only around the turn of the last century it started to improve. And so what you see then is this very dramatic improvement. So life expectancy has virtually doubled in the world in less than a century, which is quite extraordinary. And when you look at this chart, you'll see that the Africa line, it's lower than the rest. But you can see that actually over the last really 15 years or so, there's been very rapid progress in Africa. And this, of course, is the period of the Millennium Development Goals, when there was a lot of coordinated, concerted global efforts to improve health and healthcare. And one of the things it tells us is that the value of health interventions, that increase in life expectancy, is due to lots of things. Health improves for many reasons. The social determinants of health, things affect health, not just healthcare. But some of the remarkable progress in the last decade or so is very clearly due to health interventions, like vaccinations and drugs and health education and so on. And so what this says is that the roles that we play as health workers is really important in the progress that we've seen, and it's going to be, I think, the same as we look into the next stage. So now we're in a different phase of development, let's say. We're now got sustainable development goals. And so this is maybe a more progressive agenda, it's more integrated. It looks in a more broader way at various things that affect development. And like with the MDGs, you can see health right across all of these goals. And one of them particularly focuses on healthcare. And what's progressed from the Millennium Development Goals is much greater clarity about the health goals. Like we had 3 health goals in the MDGs, but they were a bit piecemeal. There was one on major diseases, infectious diseases, there was one on maternal and child health, there was one on child health. But now we have an agenda that's very much these all health issues, so there's none excluded. And more than that, when you look at the detail under this goal 3 about health and well-being, it describes what's needed in terms of healthcare that's needed to deliver better health. And this is universal health coverage. And I really like the way the global community has really come together around this very important understanding of what type of healthcare is needed in order to achieve better health and well-being. And you can see that the whole global movement around UHC. And I'd like just to say a couple of things about universal health coverage, because I think it's so important to everything we do and why we train nurses and what they do and so on. It comes back to this agenda that is about everyone, everywhere, getting the health care they need without experiencing financial hardship. And you know the motto, leave no one behind. And Gatinji referred to it this morning. He says it's reaching the furthest behind first. And that's kind of the motto in Ireland's new development policy, that came out in the last couple of months. And to me, it says a couple of things about when you think about universal coverage. One is that every country needs to have an organized system in place that provides healthcare that is available to everyone. So that's one thing. And of course, one of the things that says and I think in terms of nursing is, well, nurses are everywhere. So wherever the organized healthcare is, you would expect that you will have nurses. But I think it's more than that, because there are some people who get left behind, who even if you have the healthcare there in front of them, they're not going to access it. People who are marginalized, disadvantaged. Maybe there's stigma associated with diseases they have. Maybe they're discriminated against because of all sorts of reasons. It could be ethnicity, it could be gender, it could be sexual orientation, it could be lifestyle things, a whole lot of things. But these people are very hard to reach. And so part of the UHC agenda is coming up with creative strategies to reach the people that aren't easily reached. And sometimes that brings in the role of the non-governmental sector, and NGOs can be very effective in reaching some of these groups. But again, I see nursing again is very central to this agenda. So when I look at this UHC agenda, it always brings me back to Alma Ata and primary health care. Now, most of you here are probably younger than me and mightn't remember back to the days of primary health care. But to me, primary health care was always the right agenda. And I think universal health coverage is almost, to me, like a restatement of what was said way back, but that wasn't really adopted very well. And so it was quite nice to see then the 40th anniversary of primary health care being celebrated last year in Astana, reaffirming that commitment to primary health care. And again, it's just emphasizing the point that universal health coverage is essentially about services that are community-based. Of course you need referral to higher levels of care, but it is essentially, if you're going to reach everyone, it's got to be based in the community where people are living. And that was reaffirmed last year at the 40th anniversary of Alma Ata. And within that, highlighted too the importance and centrality of the health workforce for that. So I think there's a very clear agenda for the team at this conference that nursing is going to be central to the UHC agenda. So coming back then to the SDG 3, and I said if you go down into the detail, you'll find a lot more about the how to deliver care, and there's one of the targets is very specifically around the health workforce and focusing on developing the health workforce, particularly in lower income countries. And if you look at what's needed, you see it's a very big investment. The biggest single investment for if universal health coverage is to be achieved, well, this is for SDG 3 actually, but the biggest single investment that's needed for for improving health is actually health workforce. And so it's really important to have meetings like this where the workforce is looked at. Sometimes it's hard to get people excited about workforce issues. They're more interested in the technical things as maternal health or TB or HIV or whatever. But actually you can't deliver any of the service or any of those without workers. And so to have the opportunities to come together and look at how do you develop the workforce that's going to deliver the services, it's very crucial. And I'm not going to steal her thunder, but Barbara speaking after me is going to be talking about nursing now. And really, I only just wanted to highlight it as just something, a very positive global development in terms of the role of nursing. That's really, I think, put a spotlight on nurses, reminding, I think, everyone that actually they make up most of the workforce. So clearly, whatever workforce solutions are needed for universal health coverage, nurses are very central to that. And very much at the heart of health workforce teams, and that they're very much embedded in communities. But what, I mean, Barbara will talk about what Nursing Now is doing, but I think the whole thrust of nurses in leadership, I think that's a really positive development. And I think hopefully it will be something that really strengthens the contribution that nurses will make to universal health coverage. So going back to some of the work that was done to develop the global strategy on human resources for health, one of the questions, of course, is how many workers do you need? And that debate is always there. It used to be 2.3 doctors, nurses, and midwives per 1,000. That wasn't ever a target. It was sort of just like saying, well, if you had more than that, you were better off than if you had less. It was sort of became a bit of a benchmark. But now that figure has been revised up. Now we talk about 4.45 per 1,000. And that's really taking account of looking at the healthcare needs are broader than they were before. And if you factor in non-communicable diseases particularly, but the full range of services that should be available to everyone, then that's a more realistic figure, while still, one would have to say, kind of a very basic or low figure. But it's quite a helpful one in terms of just then trying to understand what the needs are and what the challenges are. And here are some slides from WHO that I think help look at that. So this line here that you see, this green line, is saying there's a need. There's a need for a certain number of health workers, and we're saying it's at least 4.4 per 1,000. Or this is midwives, nurses, and physicians. So the question then is the supply. What's the supply? And that's what you would like it to be. You'd like the supply to match the need. What's the reality is there's a deficit. Deficit particularly in lower income countries. The supply of health workers, these health workers, is less than what's required. Now, another aspect of this, and this is the employment side, which you also need to look at, which is the demand. It's the economic demand. So the economic demand is what creates the jobs. You can have the health workers, but if there's no jobs, that's not much use. So you also want the demand to match the need and the supply. And here you see again, in lower income countries, the demand is insufficient. If you look at the budget, the resources of lower income countries, they are not sufficient to pay all the health workers if you were to match that need. So that's a challenge. Then a further complication, if you go look at the high income countries, the demand for health workers is greater than the need. Because in richer countries, we like all sorts of fancy things like plastic surgery to improve the way we look. That wouldn't be perhaps a need, but it's a demand. And so if these countries are demanding more healthcare than they need and more than their supply, then what happens? They draw on other countries and lower income countries. So that compounds the problem in lower income countries. So we have this shortage. Looking forward to 2030 of projected about 18 million. So it's predicted or estimated, whatever, that projected, that's the right word, that there'll be about 40 million additional health jobs created by 2030. So where are the jobs going to be? And you can look across the different regions and you see most of the health jobs will be created in the coming decade are going to be in the upper and lower middle income countries. Relatively speaking, very few in the low income countries. So there's the problem. You have the supply is not going to meet the need, and you've got a shortage of 18 million, and the shortage is particularly in the low income countries. So lots of challenges. continuing deficits. There are deficits. They are projected to continue. There isn't enough investment in the sector, which means that there isn't the funds to create for the demand that's going to create the jobs. There's huge inequalities. That's a big part of this problem. Richer countries then drawing on poorer countries. And we have the whole challenge of labour mobility within that. So many challenges. But it does, I think, just call on us then when we're looking at the role of the health workers, whether it's nurses or whoever, is you need to look at the labour market to see, because there's a whole lot of things that go on that will affect nurses being produced and then employed. And there's a whole lot of policy implications and very practical things that countries need to look at. And one of the big things is, of course, to expand the fiscal space so there's more money available to employ more workers. So now I'm going to just move back to this strategy and just look at there are 4 objectives in the strategy and just make a few comments, some of which maybe are things that were referred to this morning in relation to that, as particularly thinking of with nursing in mind. And the 4 objectives of the strategy are, well, firstly about optimizing the current workforce. So in other words, whatever workforce we have now, let's use that as effectively as possible. Then looking ahead, how do you produce and invest in the workforce needed for the future? Then the third one is around strengthening capacity, individual institutional capacity. So you need people who are going to plan and manage the workforce and lead it. This is a critical piece. And then lastly, there's another objective around data and evidence. Again, that's very important, that if we don't have good information about workforce, it's quite hard then to make good decisions. So the first one, optimizing the existing workforce. And I'm just going to pick up on a few issues here. And some of these we spoke about a bit this morning. So skills mix. So this, I think, is really just again to say, when you're looking at workforce, don't just think of nurses. You need to think the whole picture of the workforce that's needed and the skills mix that's required. And then for education and training, focus then on the practice and what's needed then for to meet the full spectrum of health needs. So there is need in countries, I think, to change the current configuration. And one thing it's clear is that for countries to continue to invest in higher paid health professionals, and this is doctors and nurses, is actually looking forward, is unaffordable. Unless there's a different skill mix, countries certainly like our country, Ireland, we cannot afford to continue just to expand the type of model of healthcare with the type of workforce. So we need to look at it in a different way. And so countries are responding to this challenge, and every country, I think, to varying degrees, has looked into changing the roles then that different groups, different professionals contribute, like task shifting, task sharing, that I think you're all familiar with. And so this is, I think, something that that has to be done. I don't think that's an option. I think if you look at, and again, because we're here, I'll take nurses as an example. It's probably the case that many nurses are doing jobs that other people could do. And that sometimes, if you go to, I was looking at one example of from Uganda, where they talk about they did an assessment and found, well, nurses, they're cleaning floors or changing beds and all sorts of things that are not utilizing the skills that they were trained for. So some of those could be delegated to someone else. At the same time, there's lots of tasks nurses could take on that are not being met at the moment that perhaps traditionally others did. And I think we saw that with the example we're all familiar with is with task shifting for HIV. And nurses took on a very key role in the rollout of antiretroviral therapy for HIV. And now we see the emergence of a whole lot of new roles that nurses are taking on. And in my country, in Ireland, we see we've clinical nurse specialists and advanced nurse practitioners in a whole range of areas. And a lot of this is responding to some of the biggest health challenges, like chronic diseases, non-communicable diseases. That's our biggest challenge. Now, for this to happen, it's not something that any group can do in isolation. And it's not just something for nursing bodies to work out. It requires the coming together of a whole lot of different stakeholders, governments, professional bodies and associations, there's the unions, there's obviously the educational institutions. And all of these need to come together if you're going to effectively make the changes that are going to be needed. And I mentioned about the importance too of interprofessional training or interdisciplinary education and training, because you need to be preparing people to work much more in team-based work in the future. So I think a big opportunity for nursing, I think undoubtedly, is the role in non-communicable diseases, and I think several people have referred to that. It's now becoming the biggest burden of disease across all countries, not taking over in the lower income countries from communicable diseases. And I think there's a need really to develop very effective responses to that, and both in prevention and treatment. And I think there's a big role for nurses there. We mentioned this morning too about working to full scope of practice. I think this is just obviously important that you want, when you train people as professionals, that they're working to the full utilization of their skills. And I think nursing has been very good, I think, at adapting to needs and kind of using skills in effective ways. One of the issues that's very much on the agenda generally around health workforce is around decent work, and the ILO are very much engaged with WHO around looking at some of these issues, and they've been a key part of the implementation of the work of the UN High-Level Commission on Health, Employment and Economic Growth. And I think it's helped advance the thinking around good working conditions and how you support and supervise people to work well. And I think maybe a move away from the traditional approach of supervision as well as trying to get the most out of people by trying to make sure that they deliver and hold them accountable for delivering and reaching targets and performance standards and all of that. And some of that was maybe somewhat maybe negative and demanding, not always supportive of staff. So positive practice environments are very important, looking at respecting rights, eliminating gender-based discrimination and violence and harassment. Staff engagement, I think, has become much more to the fore, people recognizing that you need to value your staff much more and engage them in decision-making around their roles and listen to them, and so that they feel valued and empowered, and they're giving more scope to develop and implement their services. What I've shown here is just something from the Irish Health Service as part of our framework for quality improvement, where we see one of the key drivers of quality is staff engagement. If you want to improve quality of services, you need to involve your staff. And people often say, is that happy staff or productive staff? And if staff feel that they're supported, and we talk about flourishing, enable people to flourish, so that when people come in, they're really feel that they're able to express themselves in their work and really work to their potential and be fulfilled in it. I can't do a presentation like this without saying something about gender equity, and I'd like to refer you to this report. This is from one of the thematic hubs of the Global Health Workforce Network. It's called Delivered by Women, Led by Men. And it's a very good analysis of some of the challenges in relation to gender inequality and inequity. And I think these are very relevant to improving and strengthening the role of nursing, because nursing is mainly women. I can't read it on the screen, so I have to look around here. But you'll see here 4 kind of key areas: occupational segregation, leadership, decent work, and gender pay gap. And it's very clear when you look in many, many different ways how this gender norms and gender stereotyping works against women. And I think that doesn't help in terms of nursing, because nurses are more women. And there's a whole lot of issues that need to be addressed. And I think it goes back even to before people come into education. So even at the stage of school education, gender stereotyping isn't being reinforced. And that it is, and girls and women are facilitated to come into training and education in nursing. And then throughout the education and then into employment, that any issues of discrimination are addressed. And there's a lot of things that still need to happen. And it's very important that where women are working sometimes in remote areas, that they're safe and that they're able to work in contexts where their well-being is respected and looked after. So moving on to the second goal, which is about anticipating the future workforce, and this is about investments and what this really is about: investing in education and investing in employment. And I think I've covered really a lot of this, but this is about who's going to fund. It's where does the funding come from to support the things we've talked about, the deficit of health workers and the need to expand, particularly in community-based roles. And then furthermore then to invest in employment. Then to move on to the third, which is about strengthening individual and institutional capacity, and this is really, I think, where I want to pick up is on the issue of leadership, and we'll hear more about it in the next presentation, but just there's lots of good examples, I think, now of where training nurses in leadership is proving very beneficial and is having real impact in terms of improving quality of care. And I'm just highlighting this an example from Zambia that I came across in the IntraHealth newsletter. So this is from IntraHealth, and it just talks as an example of training nurses in leadership in Zambia and the impact that had on quality of care. So that's leadership at the frontline level, and I think leadership extends, I think, to all levels, but really important in terms of nursing. And then lastly, the issue of data and evidence. And I'm very encouraged coming to a conference like this to see how much evidence is being presented, lots of papers. And I think this is really important. A lot of when you look at the global strategy and the UN Commission work, that's all informed by what the evidence is. So I encourage you to develop the evidence, and then that's what the policymakers can take, and hopefully that can be helpful then in developing nursing. So that's where I'm going to conclude. Just a few final remarks. UHC, as I said this morning, UHC will not be achieved without public health nursing. I think that's fairly apparent to me. I think public health nursing can be a leader in transforming and delivering health services for universal health coverage. And this network, I think, can play a role in strengthening public health nursing across all countries. That's your motto at the bottom. Together we are strong for health and well-being. So be strong, everyone. Thank you.